Hello, my name is Dr. Manos, and I graduated from Johns Hopkins Medical School. Welcome to Sentara Hospital. Today, I have 3 patients who are desperately seeking medical advice. Oh look, here's my first patient now. Good morning, Gabby.
Good morning, doctor.
What brings you in today?
Well, I was running yesterday, and I noticed that I wasn't sweating. Is that a major concern?
Do not panic, Gabby. What are your symptoms?
Well, I've been having dry mouth, and I can't cool down and I don't sweat like everyone else.
Have you been taking any new medications such as Topramate? Because this can cause hypohidrosis in certain patients.
I don't think so.
Well, Gabby, it seems like you have hyperhidrosis. Basically, this means you have a homeostasis imbalance in your body due to a neurological disease that you seem to have. Because of this, you don't sweat as much as others.
Does this mean I can't exercise in the heat?
You should be cautious about the temperature you're working out in and the amount of time you spend working out. You also are more prone to heat stroke.
Okay, thank you for helping me. I was very worried that something extremely wrong was happening. Thank you.
Goodbye, Gabby.
Bye.
My next patient should be here for her routine checkup. Let me go check. Here she is. This is Annie Bashara. Hello, Annie.
Hello, Dr. Manos.
Now, Annie, earlier this morning, I had a patient who was diagnosed with hypohidrosis, which is a lack of sweating. I know you're very athletic and like to play sports and work out. How have you been feeling when you exercise?
I've been feeling great. However, when I hit puberty, I realized that my sweat glands became more active.
That is good and normal. Women have more glands than men, but men's are more active typically. Everyone is born with 2 to 4 million sweat glands.
Is there another name for sweating?
There is. It's called perspiration, which is the release of salty liquids from the body's sweat glands. Has your temperature been normal lately?
Yes.
Good. Just make sure after you sweat a lot, you drink water, try to lower your temperature, and wash your body so the salt from your sweat glands doesn't dry out your skin.
Since I'm here, I was wondering what causes sweating and temperature regulation.
The primary thermoregulatory is located in the preoptic hypothalamic regions of the brain. This causes sweat glands to be active. In addition to a central neural drive for sweating in the brain, sweating can also be initiated by an axon reflex.
Thank you for all this helpful information. I can now pass this on to my fellow athletes.
Bye, Dr. Maynard. Bye. That was a fabulous checkup routine. My next patient is here for a chronic issue he's been having. Let me go get him. This is Lex Seelig. Let's find out what issues he's been having. What seems to be the problem, Lex?
Hello, Dr. Manos. I've been experiencing large amounts of sweating for some reason, and I don't know why. I feel like this problem has been affecting my daily life.
I see that, Lex. You've got a bit of sweat there on your hands, armpit, and face. Is there any reason you'd be sweating so much right now?
No, there isn't.
Have you been taking any medications?
No, but I've been feeling nervous and I've been in a lot of stressful situations. I've been feeling less confident.
Have you been noticing any instances where your sweating has gotten progressively worse?
At school, I have been put in a lot of groups for projects where I don't feel confident at all. Also, at night I tend to sweat more.
Well, Lex, it seems that you have hyperhidrosis. This means that you sweat excessively in certain areas.
Is there anything I can do to stop this?
Yes, there are a few options. You can take medication orally, or the more invasive method is you can get Botox injections.
Are Botox injections safe?
They certainly are. Botox injections are FDA approved. However, if you do not want to get Botox injections, there is a surgical procedure that can cut down your sweating.
I think I may do the Botox injections.
Okay, well you'll need to get 12 to 14 injections and the effects will last 6 to 10 months.
That sounds alright. Thank you for the helpful information on my disease.
You're welcome, Lex. Those are my 3 patients for today. Now we know all we need to know about the endocrine system, the exocrine glands, and sweating. Thanks for joining me, Gabby, Annie, and Lex during their appointments. Happy sweating!
Oh, are we actually doing it?
Where are we actually filming?
Y'all see my
Shake your money maker!
The cup is
Gabby,
so
focus. Earlier this morning. Lex. Gabby, focus.
And I can't cool
Okay.
Sorry, I just